You've just been given the diagnosis that you have metastatic prostate cancer, and you have questions whether your doctor failed to timely diagnose your prostate cancer. I'm Stuart Scott, medical malpractice attorney with the Spangenberg firm. One of the most common forms of cancer in men is prostate cancer. It's the #2 cancer killer in men in this country. The good news is, however, those men who have prostate cancer, it is one of the most curable forms of cancer there is. Any man who is over the age of 50 years old should be getting prostate exams and PSA tests. And men who have a family history or who are of African American descent should be getting these tests at age 40. So what is a PSA test? A PSA test is a blood test specific to determining whether there's early signs of prostate cancer. This is a blood test that every man should be getting on an annual basis. But here's the problem. Sometimes doctors don't order the tests for their patients every year, or they fail to order it at all. Without the PSA test, there's going to be no early detection system for prostate cancer. Here's the other problem. Sometimes doctors actually do order the PSA test, but they don't know how to interpret it correctly, and the early signs of prostate cancer are ignored. Any PSA test with a level of 4.0 or higher is a red flag for the possibility that you have prostate cancer. The other situation that is alarming is if your PSA test has gone up by more than 0.75. So if your PSA test from one year to the next has gone from 2 to 3 while it's still below 4, you'd have to be concerned because it's going up so rapidly. Anytime one of these PSA tests reveal a significant risk or possibility of prostate cancer, your doctor should discuss with you about having a prostate biopsy. So what is a prostate biopsy? Usually it's performed by a urologist, a surgical procedure where they take 12 or 24 long, thin cores out of various areas of your prostate. This tissue is removed and then given to another doctor called a pathologist. That doctor will examine those tissues under the microscope, and they will determine whether or not you have prostate cancer. If you do, they will then evaluate it to see how aggressive your prostate cancer is. When we say aggressive, we're talking about how likely is it that it will metastasize or leave the prostate and go to other areas of the body. Now, specific to prostate cancer is something called the Gleason score. The Gleason score is how the pathologist describes how aggressive the cancer is. The score is from 1 to 10. 1 being the most benign and 10 being the most serious. Now, oftentimes men are diagnosed with cancer and their Gleason score is a 4 or a 5 or a 6. And these men can be told either they can have treatment or watchful waiting. Watchful waiting is the decision to hold off on treatment, usually the removal of the prostate, in favor of just simply watching the cancer. On the other hand, where men have a high Gleason score, a 7 or 8, they require treatment because that cancer is very likely to metastasize. The treatment option, generally speaking, is going to be a prostatectomy, where the prostate is entirely removed. You may have questions about your own matter. If you do, give us a call. We're here to give you answers. It's what we do every day.